you feel that using your Gepan with your catheter, do you feel that that's helped you during the pandemic?
Had I not been able to self-instill, I wouldn't have had any Gepan installations at all, because the hospital was closed during lockdown, or as in you couldn't go to the hospital. During the lockdown, the hospital sent me a package of more Gepan installations. I was beginning to have pain at the end of 2016, but it took until the following May to get diagnosed. I was just being given very strong painkillers, basically, by the GP, but clearly they didn't really have any effect. And actually, well, I guess initially antibiotic. When I remember first going to the NHS hospital, we have this other product called Gepan. The nurse asked me if I would be prepared to try and do these installations myself at home. And I said, well, of course, because it's a bit of a nuisance having to come to the hospital, wait in line, and for you to do something that only takes you, a minute? If there's some way that I can do this at home, of course, it will be a lot more convenient for you and for me. So she showed me how to self-instill, which was a little tricky at first. You have to laugh. I didn't actually realise where my urethra was. She sort of put a mirror down there so I could see my undercarriage, so to speak. I was quite surprised. It wasn't anywhere near where I thought. So after some practice, yes, I managed to put the catheter into myself without her help. And so she duly sent me home with a few packages of Gepan installation and some catheters, and been continuing to do it since then. And then I actually do the installations myself at home, which I much prefer, because I can do them when I want, when I need to, in the comfort of my own home. And I know I can lie down immediately afterwards and just rest and let the Gepan do its thing. Whereas obviously if you have to go to a hospital and have the Gepan put in there, because they're not going to allow you to have a rest, you can kick you straight out. Obviously, you've got to get home. Maybe you've driven there or gone by bus or walked, and that must be more difficult. So, yeah, a lot of advantages there, and I don't always get it right first time, I have to admit, but you do eventually manage it. I haven't had to take up the time of a urology nurse, which, to be quite honest with you, could be seeing other patients who are new to interstitial cystitis or other similar problems. I feel as though I'm helping the NHS by doing this treatment myself. I feel good about that. Absolutely, have a go. Try it. You can do it. Yes, it will be a bit tricky at first, but continue trying, because it will be worthwhile once you've mastered the technique, and just think of it as one of those things you're going to have to do on a regular basis. Just get on with it. Just get over it. Okay? There are worse things. There's far worse things in life. So self-installation, it's not painful while you're doing it. It's a bit awkward, but no worse than that. I'm in my late 60s. Friends of mine, I've had friends who've died from cancer, who've had knee replacements, hip replacements, things that, I don't have any of that. All I have is this interstitial cystitis. I can hardly say it. It's a condition I live with, and I feel, it's not nice, and I wouldn't wish it on my worst enemy. But I guess I'm grateful that there is something out there, this Gepan. I can still enjoy life.